I know we'll have some more students that sign on. Dr. Burko, just so you're aware, this session will be recorded. So just wanted to let you know. And then students who are jumping on, hopefully you've been joining us for the entire series. But if not, welcome. You came for a great one starting tonight. So we're showcasing the U, which is University of Utah, at least for us, depending on where you're at. Could be another school, but for us, it's the University of Utah. So thank you all for joining tonight. Really excited to be hosting the U. Like I said, my name's Laura Miner. I'm the current Western Regional Representative for EM and the incoming Vice Chair for EM. We've had some technical difficulties with the chat in previous sessions, so I real quick will share a PowerPoint slide for students. Hopefully y'all can see that. Let's see.
Can they, because I can't see any of their videos, but they can see us?
Yes, that's correct. Yeah, students, you might be able to turn your camera on. Generally speaking, we haven't had that, but so I'm just going to throw this up here for a couple minutes real quick. For those of you who have joined us before, this is my spiel on scan the QR code. It'll have all of our EM student benefits. There's a ton of benefits for students, lots of ways to get involved in leadership. We have committee sections, all kinds of fun stuff. That's also our social media page on there as well. So there's always fun activities going on there for you to tune into. And then I also put my email address. So if any of you ever have any questions throughout the series, please feel free to reach out to me. I love answering questions. And if I can't, I will definitely get you in touch with someone who can. And then I also put the Use social media page on there as well. It's a very fun one to follow, so I encourage all of you to join that. I'll leave this on here for 10 more seconds probably, and then we'll get things going. We've got a good lineup. Dr. Bollier, did I get it right again? Okay.
Yeah.
Dr. Bollier is program director at the University of Utah, and so I'm really excited to be hosting them. We're going to do the same format that we've been doing for the other showcases, so I'll let you guys introduce yourselves, say what role you are with the program, and then I'll let you have the floor to share your presentation. And then from there, we will open it up for Q&A. I'll be monitoring that. Some students will type in their questions rather than speak, so I can monitor that. Yeah, so this is really informal, fun way to get to know your program. Thank you for taking time out of your schedules. Really excited to be hosting you guys. And with that, I will stop sharing. I can put this at the end for students if they need it again, but I will stop sharing and then let you take it away.
Awesome. Okay, cool. Welcome, guys. Super excited to be here. And thank you, Laura, for coordinating and putting this all together. I guess we can do a quick intro. So I'm Allie. I'm the program director at the University of Utah. I did my residency training at UMass and come from Massachusetts originally, made my way west doing fellowship in medical education at Ohio State, and then came here a couple of years ago and recently took over as program director. So I really love this program. I might have our team introduce themselves. I know this is conflicting with a residency event tonight. They're going to be zooming in from a party. I don't know, Burko or Rachel, do you want to introduce yourselves? Oh, we can't hear you.
Hold on.
Oh.
I'll just wait. Will you hear me now? All right. My name's Josh. I'm one of the second years at the University of Utah EM residency program here. I'm one of the future chief residents. And then we're having a big Passover party right now. So we have a handful of the residents over here and having a really good time, just kind of spending time together on our days off and getting to hang out nice.
Awesome. Thanks, Josh. Oh, and Harsh is there too. Hey, Harsh. Okay, cool. Harsh is one of our senior residents and is graduating way too soon. Rob, do you want to do your intro?
Sure. I'm Robert. Sorry, I came here a little late. Stephen, I'm one of the associate program director. Been at the university for longer than anyone else here, as you can tell by the gray hair. And yeah, I don't have much else to add. What else do you want me to say?
Oh, I don't know. I'm just saying hello. And then it's weird because I can't see any of the participant screen. So it's just us that I can see.
Same here.
Rachel, do you want to introduce yourself or are you somewhere?
And then Rachel's actually Dr. Iki, one of our interns logging in. It's because Rachel's working in the sticky right now.
Okay. I forgot Rachel is in the sticky. Maddie, if you want to introduce yourself now, or you can unmute and answer questions as we go.
Hi, guys. Sorry, it took a second to unmute there. I don't know why it says Dr. Rachel Brem, but I'm Maddie, and I'm here with Paige and Jess, who are two of our other colleagues. We're all first years, soon to be second years at the University of Utah, and loving it and enjoying some sunshine on the porch right now.
Awesome. Thanks, guys. All right, cool. I have a quick PowerPoint to go through, and then I guess we'll answer some questions in the chat. Can everyone see my screen? Cool. All right, awesome. So we're the University of Utah Emergency Medicine Residency Program. See if we can advance this. This is our program leadership team. So just to run through the squad, the person skiing, we have two persons skiing. The one in orange is TJ. He's one of our APDs, and he is also the APD for Wilderness Medicine Fellowship. Christine Carlson is our program manager and does everything for our program and is absolutely amazing. Rob introduced himself already, and so did I. With the Sunflowers is Christine Raps. She's one of our APDs and also an APD for the third year clerkship and runs our didactics. We have Brendan Cummins, who's the APD out of Intermountain, and Dan, who is also one of our program coordinators. So we have a really fantastic team to help run the whole show at the University of Utah. So the quick version is that we're a 3-year program. We have 12 residents a year. Our shift lengths at the main ER are 6. We have a princess shift. We have 6, 7, 8, and 9 hour shifts. So day shifts are usually 9 hours and overnights are 7, which is really nice. We have a good shift schedule. It's about 20 shifts in 28 days when you're a 1, and then it goes down as you advance in residency. Currently, we have a teams approach. So you work one-on-one with an attending. And sometimes you have an extra learner, whether that's off service or a medical student, but mostly you're one-on-one with an attending. And then lastly, there's lots of moonlighting available as a PGY 2 and 3 if you're in good standing. You can go to Riverton. There's Lehigh Pediatrics Emergency Medicine. And then there's also internal moonlighting at our shop as well. We have a lot of different clinical sites. The University of Utah is our main clinical site. It's about 55,000 patient visits per year. Very complex, complicated patients. These are the patients that come in with like double lung transplants and on like various immunosuppression, things like that. We also do see some bread and butter emergency medicine, but a lot of complicated care at the U. Intermountain is an all catchment area in the middle of the valley, about 80,000 patient visits per year. They see a lot of really good trauma, and our resident trauma rotation is based out of Intermountain. Both the University of Utah and Intermountain are both level 1 trauma centers, which is really unique to our program, that you get to spend your time at 2 very different emergency departments, but that both take care of level 1 trauma patients. We also rotate at the VA, Primary Children's Hospital, and Primaries has a new satellite site in Lehigh where we're able to do peds anesthesia, which has been really awesome. And I think Burko did that rotation and got, I want to say like 50 tubes for pediatrics, which was really, really amazing. And then we also have Mountain West, which is our critical access site. I don't know if the residents want to chime in and talk about any of their favorite sites. Otherwise, I can run through the rest of this PowerPoint.
They're all great. I think every place is different and holds a special place in our heart. We obviously love the U for some of the culture that we have and seeing our friends. Intermountain, we definitely get an awesome, robust trauma and ICU experience. The VA has its own very interesting population and kind of a limited resource setting. And then the children's hospitals, they just love to have us because we do so much there. And I think we get a lot of learning from their providers, and they're stoked to have us all the way around.
Mountain West is also really fun, I think, as a true rural experience without having to go live somewhere else for a month. It's about like 45 minutes outside of Salt Lake City. And they're kind of like the only hospital between Salt Lake and Nevada. And so a lot of like really sick traumas have to make a little pit stop at Mountain West to get stabilized and then shipped to the U. So you have no resources. It's all on you. And it's really fun management. And you learn to transfer patients and things like that, working in a low resource setting.
Awesome. Thanks. And the nice thing about Mountain West too is it's funded by this program called the Return Program. So they pay for your like gas to go out there. And if you have any other sites in Utah that are critical access that you want to rotate at, they pay for housing, your mileage, and the rotation itself. So it's really awesome grant that we have. Let's see. So salary and benefits, super competitive, especially compared to when I trained. We're at, I think, the 90th or 95th percentile for salary out of all residencies and EM residency programs. We have 4 weeks of paid vacation per year, lots of benefits. We pay for step 3, Rosh review, and a textbook of your choice. Right now, we're sending all of the PGY2s to SAEN, and the current 3s are finishing up and going to ASEP this year, which is in Salt Lake. We cover all of your membership dues. There's tons of meal money. The residents love the Rice Krispie treats, I think, at one of the shops. And let's see what else I want to talk about for salary and benefits. Yeah, that's pretty much it. Just very competitive salary. We have full benefits and we'll pay for you to go to, oh yeah, Thursday Rice Krispies at the U. They always leave shift and set a timer and then come back with like gigantic Rice Krispie treats, which is always fun to see. All right. So I want to talk a little bit about the special things about our program. The first thing is Education Week. So when new interns come and we have a special Education Week planned by the Chiefs, which Burko is currently working on planning. And we do a lot of different things that are things that we don't get to do throughout the year. So there's like fellowship and career panels, kind of life and finance lectures, lots of welcome events, and it's all protected time for the residents. So the current or like the outgoing third years who are about to graduate cover the department and allow us to have this protected time where you're off from all clinical duties and you just get to be with your classmates and get some extra learning. And then at the end of Education Week, we have retreat, which is 3 nights. All the residents, their partners, their families come. We do lots of team building events, have med wars, and then also have some partner specific sessions. So lots of really great fun here. It's really great bonding. For the incoming interns, it essentially welcomes them. And then by the end of retreat, they feel like they're a part of the family. I don't know if any of the residents want to talk about retreat and what your experience was. If not, I can keep mowing through. Oh, yay. More people.
Retreat.
Retreat was awesome. We're actually in the midst of planning it for our incoming interns. It's a super fun experience where essentially you just come into residency and bond for 7 days. A lot of team building activities, a lot of fun downtime to get to know each other. And partners are involved, dogs are involved. I don't think anybody's brought their cat, but we wouldn't be opposed to it.
Last year we had snakes, but that wasn't by invitation.
I was the Utah Wilderness Medicine experience there at its finest. But yeah, faculty does a really good job of taking care of us and they love to show up and participate too. So you get to know everybody on a first name basis.
I totally echo everything that everyone just said. And I think the big thing is that as an intern, you show up and you go to adult summer camp before you even start working. And it's the best thing ever because you get to bond with everyone. And we did a slip and slide last year and John and I were just reflecting, my partner, about how often you get to do that as an adult and with like 50 new friends. It's pretty wonderful, a little bit overwhelming in the best way. And we're so looking forward to it this year.
Awesome. And Rob makes a mean cocktail and has the full bar set up, which is even better. Awesome. I already bought a mini pool for retreat for all the kiddos. So once you get back from retreat, you have a little bit of time to rest. We jump into intern orientation. So this is protected time for you guys. You're going to work less shifts during this month. I think it's 8 shifts for the whole month. There's lots of sim, lots of procedure labs. There's intern specific lectures, and you're also double covered on shifts. So not only do you have less shifts, but you're also double covered. So there's no stress to see patients. It's just, how do I log in? Where's the bathroom? How do I put in orders? Very protected time, but also really great just to make sure you hit the ground running in August. Our procedure lab is also pretty awesome. What we do is mastery-based learning and one-on-one procedures. So you get basically hands-on training with a faculty member or resident and get a ton of reps in on all the high acuity procedures before you even start. And we do that 2 to 3 days just so you get your reps in for central lines, chest tubes, you name it, and you're ready to hit the ground running when you start your clinical shifts. Resident rotation. So this is just a messy slide, but lots of different rotations that we have. A couple new ones that I'd like to highlight. First is IR. When I was meeting with the IR program director, he wanted his residents to rotate with us because it's a new requirement for them. And he was telling me that they were so well trained that they do 120 central lines in a week. And I was like, whoa, how do they do that? And it turns out that they have an IR suite where you just go and you just put in central lines. So we're going to have our interns do that. So that way they can get hands-on reps on real patients after they do their procedure labs. And that just helps set them up well for the rest of the year. Other cool rotations, let's see. Another new one is peds anesthesia, which Rob helped set up. I don't know Burko, you got to do peds anesthesia. Do you want to talk about that?
Yeah, totally. And I appreciate you guys letting me know. I was typing a lot of stuff in the chat to you guys, but apparently nobody else can see it except for the host and the panelists. But yeah, so like Ali said, I did the peds PICU anesthesia rotation as an elective because it wasn't quite set up yet for our PGY3 rotations, but now it is. It rocks. 55 pediatric intubations, all direct, no video, super difficult airways. The anesthesiologists love to teach you. And then other things I typed out that you guys can't see, we get a retirement match. And then Allie's absolutely right. We love the University of Utah Thursday Rice Krispie treats.
At Pete's Anesthesia, I think I got to tube like a 3-day-old, like 28-weeker or something. So that
Yeah.
experience is like pretty unparalleled. So great to be able to do that on someone else's license and not my own.
Yeah, that's terrifying. Any other rotations that you guys really love that you want to highlight?
Oh, they're all super good. It's hard to pick favorites, frankly. I'm a second year, so I really enjoyed my time in the STICU. I really got a lot of really good learning in the PICU. The ICU is scary, particularly as an intern, when you kind of get thrown in on that SICU rotation intern year and they say, you're going to be alone. That was some of the best learning I had. It really set me up for success in my last 2 years. So I'm looking forward to a lot of the EM time that we get to spend in our third year, and running the trauma ICU is the third year. I feel we don't have any bad rotations, and the setup is incredible for like good progressive learning without too much hand holding.
Yeah, I honestly loved all our ICU experiences, which I almost did crit care, so that's probably a little bit of bias sneaking in. But our shock trauma ICU, like both as Burko said, in third year when we're running the trauma ICU on our own, and then in second year when you're on like the medical side of it, you get a ton of procedures. For one of the days of the week, you're holding like the code pager, which I had that rotation early in second year. So like I hadn't run a ton of codes yet, but after that rotation, I felt a whole lot more comfortable with it. So no, it's excellent. I think all of our ICU time is great.
Awesome. What about the intern squad? What are your favorite rotations so far?
I think we were just reflecting on this a little bit, and it's it's such a good mix, but it's pretty cool to get to do ortho like at the base of a ski hill and really see the freshest trauma. Like my partner was an ortho PA for a long time, and he's like, I haven't felt that many positive Lockmans, and you go in and everyone's tearing their ACL, and you're like, I got to do so many of those. I got to fix people who had weird cuts from the edges of their skis. So I think that's a cool, like unique to Utah and a great step up from helping manage floor orders for ortho patients to the really fresh orthopedic injuries. SICU is a great time. I think it was a good time to learn and become more comfortable with our really sick patients and become comfortable with starting pressors and other things along those lines earlier on, especially overnight, and learning. The SICU nurses at the U in particular are so excellent, and there was so much to learn from them in addition to the attendings and everyone else. So when you had questions or wondering what procedures they would do, you had the support you needed, but you were alone and had lots of people to ask what they would do next as you were figuring out your next steps. I don't know. What else do you guys have to add?
It's maybe cliche, but love like just being at home in the UED too. It's such a good experience, and like we have such good relationships with our attendings and our seniors, and like getting to learn from them and work with them hand in hand is always really awesome. I love that we are in particular one-on-one with our attendings, so you like really develop your presentation skills with lots of like tangible feedback throughout your shift, and that's like really valuable for growth.
Yeah, you guys hit it all. I got
Great.
it.
Awesome. So let's see. Next thing, didactics. We protect conference time here. So that means you are off. Your shift ends no later than 11 p.m., right? Is it 10 or 11? 11 p.m., I think, before conference. And so that way you have a good night's sleep. You don't have to show up after a night shift. There's a couple of ICU rotations that we say you don't have to show up to conference, but for the majority of rotations, conference is protected time. We have module-based systems. So that means like there's like cardiology, pulmonology, and a team of residents and attendings designs the content for that module, which make our conferences really fun, really dynamic. We're not just sitting in lecture hour after hour. There's lots of procedures, lots of hands-on simulation, lots of guest speakers, and it makes conference really engaging and really fun. We do various types of board prep. We actually have our first certifying exam board prep tomorrow that one of our APDs put together and put in a ton of work to have the full mock certifying exam for oral board set up. And the residents are in for a treat. It's going to be hard, but good. And then lots of resident faculty involvement. A couple of the pictures are pretty cool. Dr. Jane Yee bought these ears and made some pretty cool auricular hematoma models. And then this is Journal Club at Swanee's house, and he's already sent me the dates for this year for Journal Club. I don't know, any other thoughts from the resident squad or Rob on didactics? If not, we can keep going.
No, you're good. Didactics rocks. I really enjoy like our journal clubs. I feel like that's where we get a good bulk of our academic component of we're an academic residency. Plus we do a lot of community work, a lot of rural stuff. But I think we have awesome faculty that really help us break down some cool research papers. We stay super up to date, and it's fun when we get sent to some of these conferences where the attendings say, look, like you're going to this conference to network and to learn, but a lot of the stuff you'll see, they'll present it as new stuff, but we've been using it as a practice pattern the entire time in residency, while other people are presenting it as kind of new data because we've had time to go through it. And so it's interesting to go to these conferences and kind of live that and be like, man, you really are up to date. You're on top of your stuff. And it's, I think, a really fun experience that we get.
I think the thing that we'll add to this is the simulation is amazing in our conferences and it's growing. And some of our faculty have been working, all of our faculty have been working so hard to make both simulation where you're learning from your peers across all 3 years, as well as class specific simulation. And it's a great way to break up the learning and get to do a lot of hands-on care and practice those rare procedures, and also the run of the mill medical resuscitations that we do a lot in a really safe way and fail. And I think that's where I learn the most a lot of the time. And we're looking forward to even more of it next year. I know that's coming down the pipeline.
Yeah, we were able to add 2 full days at LDS, which they have an absolute beautiful sim center. So we're lucky that we have a good relationship with a lot of surrounding places. Our ultrasound faculty are phenomenal. I can't say enough good things about them. They spend so much time teaching and doing one-on-one teaching and tailored didactics as well. So when you come in as an intern, everybody does ultrasound at the start of the year. You get a week of ultrasound, lots of training. You get to go out actually on an EMS rig with a butterfly and do scanning. A lot of really creative things that they do. And then they have an OSCE at the end of the week to make sure that you are like up to a standard. And if you don't pass that, then you just get some more extra hands-on teaching. After that, you'll do one-on-one ultrasound scanning shifts with faculty for the rest of your time as a resident. And then they also have Q&A as well, where they break down images and teach the ins and outs of what they do as ultrasound faculty. There's tons of research opportunities. There's tons of teaching opportunities with the medical students on their rotations. Really, if you're interested in ultrasound, this is a great place to be. Wilderness medicine has a ton of stuff. They have journal club every month. They put on med wars twice a year. You can help out with ski patrol, lots of elective opportunities, research opportunities, and more. I don't know if Ethan's still around. He just did his wilderness elective with ski patrol.
Ethan just went back in, but he said it was incredible. He's been texting me kind of pictures, and I've been making stuff for Instagram at Utah Emergency Medicine. If you guys want to go follow it, see all the cool stuff we do. But Ethan really loved it. And I think he had a really cool experience. And then Felix, I think, just did a wilderness med experience too, where he was like ready to intubate on the mountain in his ski boots kind of thing. And you're in the thick of it. You're about as wilderness medicine as you can get without flying across the country and the world and doing some deep global medicine.
Awesome. Do you want to talk about snow day? Because that's wildernessy.
Yeah, we can talk about Snow Day. Snow Day is an annual recurring thing at the University of Utah. I'm from Florida, full disclosure. So like snow is a brand new concept to me. And then coming out here, our first snow day really talked about like EMS, avalanche safety, which is a brand new thing for me again. And we really worked on what an avalanche rescue looks like. What are some snow hazards and things that we'll encounter in the emergency department, like blocked airways, hypothermic patients, traumatic arrests. And then this year we had a different breakdown where we actually talked about decision-making heuristics and like how thinking in wilderness environments relates to your kind of thought process in the emergency department, because both environments are super unforgiving in terms of if you make a bad decision, you don't have a lot of feedback and the consequences can be dire. And so I think we had a lot of people come out from the Utah Avalanche Center, a lot of field experts, and everybody either got to snowshoe or got to go backcountry ski or got to go on a little hike through one of our lower angle snow areas and do some on the boots or boots on the ground learning in the backcountry, which was super, super awesome. Again, it's coming from a place where I've never had any of these experiences before. We're super open and friendly to it.
Awesome. Thanks, Josh. Simulation we already touched upon. We have a new simulation director who comes with a whole wealth of experience. He's put together some really great curricula and was also able to secure some extra sim days for us. So we're really excited for more sim as we continue. Global health, tons of opportunities. We also just got a new section director of global health, Ryan Ertz, and we have Jamie, who's the fellowship director. There is a $1,500 resident stipend. We've had residents go to Vietnam, to New Zealand, to Chile, and Ryan Ernst has a whole slew of places that he can set up for you if you're interested. Our one ask is that it has to be something that is beneficial to the place you're going to, and it can't just be like a one-off experience. It has to be a giving experience. There's also street medicine. Mike Morgan is one of our faculty members, and he is exceptional. He does so much for the surrounding communities, and he's the director of the 4th Street Clinic. He was able to get funding to create a mobile street unit. I don't know how to say that. And they're going to start taking residents out in the coming months. So if you're interested in street medicine, there's new opportunities for you to get involved and go out with Dr. Morgan. We also have the Indian Health Services and multiple rotations in Shiprock and Chinle if you're interested in taking care of that population. EMS, lots of event medicine. So our faculty group is contracted with the Utah Jazz, the Utah Hockey Club, and basically the Delta Center. So there's lots of opportunities to go and do event medicine with them. Right now for our EMS, it's changing to 1 week as interns, and that allows us to give you a better education experience and do right along with the fellows. And then there's disaster drills every year. They have journal club, structured didactics, and a lot more. So really excited for all the things EMS. We also have AirMed that you can do on your ortho rotation if you're interested in it, but you don't have to if you are afraid of heights like me. Did you guys do AirMed at all?
Oh yeah.
Every single intern, I swear, got to fly. They like broke the streak of nobody got to fly. All of a sudden, Tori's showing me they're doing touchdowns and landings, and I forget who else. Olivia was out there with that helmet on, showing us the whole Wasatch view. It's all on the Instagram. Again, it looks incredible, and I think it's luck of the draw. We got to fly a pretty cool stroke when I was there, and it's fun otherwise. Oh yeah, I think a handful of interns got to fly, but it's luck of the draw with weather and everything here in the Wasatch.
Yeah, it's definitely luck of the draw a little bit, but if you don't get to fly on either of your two shifts, like you can definitely seek out more opportunities with it. Yeah, I think one of my favorite cases of intern year was an AirMed shift. We had a STEMI out in the middle of nowhere, Montana. Yeah, it's a blast.
Dude, Jack got to fly in the fixed wing. I was
That's
in
what
Wyoming
fixed
and I
wing.
was like, Jack, what? So it's super cool. They let you do a lot of stuff and
Yeah.
take control. It is cool.
And I think the more interested you are in it, the more they'll let you do. So if you show up and you're really engaged, you'll get to do a lot more and go on more ships as well. And you can do this as an elective if you're interested as well. Maddie, do you have anything else to add, or you didn't get to fly?
I didn't get to fly, but I had a great time. We cleaned the helicopter off, shoveled. The folks there are so lovely. We had a great time, like learning about what's in the helicopter and kind of chatting throughout the day. And then both Paige and Jess got to fly, so I'm not jealous at all. But
Yeah, we got to fly. It was good. My first case was like on-scene trauma with a very bloody, very messy airway and very critical care, and it was really fun.
Yeah, I got to fly over the Uintas at sunset and then pick up a very medically ill patient out of Vernal, which was a blast.
Wow, that sounds amazing. Very cool. So yeah, you get to do that. And then again, if you're really interested, you love flying, you can do it as an elective as well. Special events that we have, an annual holiday party. I think we already talked about Snow Day, lots of global health, lots of event medicine opportunities. And then we send our chiefs to the court conference, our second years to SAEM. And then I think everyone's going to be going to ASAP this year because it's in Salt Lake if you guys are in town. Mentorship, we have a couple of different things. We have family, so you're with a PGY 1, 2, 3, and a faculty member. We also are introducing scholarly tracks this upcoming year, so subspecialty tracks if you're interested in wilderness, medical education, global health. There'll be a faculty mentor for group meetings 6 times per year to work on a group project. And then there's also lots of informal mentorship. So our faculty members are super approachable. They love you guys. They love teaching. They love mentoring. And so it's really easy to get in touch with any of our faculty and develop those relationships. Resident shout outs, all of our fantastic residents. So Burko, who's here, he's one of our Emma reps and also a member of the USEP board. Harsh has been a conference chair for ACOEP and also is an Emma program rep, and lots of other really awesome things that our residents do. So I just like to give them a shout out for all of the great things that they do. They're so humble, but they're so hardworking. Yeah, Harsh, I think, is the mayor. He does everything and knows everyone. So we're lucky to have Harsh and lucky that he's staying around. And then fellowships offered. So we actually have 10 fellowships offered here, which is really remarkable. It means we have faculty that specialize in all of these things as well. And you get to work with those faculty on shift. It's just an amazing place to learn. The faculty are all fantastic. They love teaching. They love mentoring you guys. They love helping you get to where you want to go in your career, whether that's academic or community or critical access. They really tailor your experience to what you want to do. We've had about 150 graduates from our program. About a third have completed fellowships. And I think the class of 2025 is pretty cool because a third are staying for fellowships at the U, a third are going critical access, and a third are going community. So this is just a list of our current class of 2025. They did amazing and are all really amazing. residents who luckily some of them are staying around because otherwise we're going to miss them. What's new? We talked about IR, a new central access rotation. We also have a Hawaii elective, which I think a few residents are going to be doing. It's a really amazing rotation, 4 weeks in Hawaii, where everything's paid for, your flight, your housing, your car, your insurance. And so that's a really great elective. And then peds anesthesia, which is hard to get pediatric tubes. So definitely excited for that. Things to do if you want to snap this QR code. It's basically just a list of all the fun things to do in Utah. It's also available on our website. And we can throw it into the chat too. And then here's our contact information. So that's the end of my slides. I will stop share. And then
So I'll open it up, students.
Okay.
There's a Q&A. I know it's confusing. So this was set up as a webinar. So we as panelists can see a chat, but the students cannot. So the students will ask questions in the Q&A, and I will happily read those out loud. Students, if you want to send those in, whatever questions I don't get to, I'm sure Dr. Burko can start typing and answer stuff.
Looks like there's a really good question here, probably for Allie B, if you want to answer that. Do you see that in the chat, or you want me to read it to you?
Any thoughts?
Yeah.
Yeah.
Oh, yeah. Sorry. You can read it.
Oh, any thoughts on what will be added if EM goes 4 years across the board?
Added in terms of what rotations we would add. Yeah. So there's a couple new requirements with the new program requirements. There's things like NICU, there's telehealth, there is urgent care, which I hope they take out. But there's a couple of new rotations that they are mandating that we won't know for sure until July 1st. So TBD on that, but we have plenty of opportunities to add in whatever the RRC tells us that we need for the 4-year programs.
I'll ask a question. So today, ironically, is the exact day that your VSLO applications opened. So for third years who are interested in your program, if they're not able to rotate with you guys, are there other ways to get involved with other electives, or is there different recommendations you have for students to stand out if they're not able to rotate with you guys?
Yeah, I guess I can take that one unless Rick wants to take it.
I also have some
Yeah.
tips. Ali, you're going to have better tips than me. So you go first and then I'll fill in.
No, you go first.
This is more general, not necessarily specific to our program, but general advice for any program that you're interested in matching to that you don't rotate at. Try to get involved with anything that program does. So webinars like this, or like the year that I applied, we at Utah did like a whole bunch of Zoom meet and greets because it was like the second year of COVID and Zoom interviews and all that stuff. So if the program is advertising usually on their social medias like Twitter or Instagram of like different Zoom socials or whatever early in the application cycle, definitely jump on that. And then look for like different national conferences. Like, again, if you're able to come to ASEP, that's great. Obviously, if you're not, don't feel obligated to, but if you are able to go to any virtual residency fairs or in-person residency fairs and go interact with them, I know that everybody who comes to our booth at ACOEP and ASEP, or every year that I've gone to it, I have sent Allie an email of here's all the names that came to our booth and showed interest. I would definitely recommend doing that for any program you're interested in that you don't get to rotate at.
And then
Yeah.
looks like there's, yeah, I'm sorry,
Okay.
Allie.
Oh, no, you're good. No, I was going to say we weigh everybody's application equally. Whether you rotate with us or not, like you still have an equal chance of coming here. I wouldn't stress too much about whether you get an in-person rotation or not.
Do you guys offer electives like wilderness med, toxicology, anything like that for students?
Yeah, so we used to offer toxicology, but they expanded it within our own school of medicine. So that's no longer going to be offered. And for anyone who is going to do the wilderness medicine elective, it's actually offered through internal medicine for some reason here, not emergency medicine. So we don't know that you rotate with them if you do a wilderness medicine elective at the University of Utah. This happens every year where people think that they're rotating with us in emergency medicine, but it's actually an internal medicine rotation. So just so you know, if you sign up for that, we won't know that you're here. So reach out if you are doing that rotation.
Thank you. I'll read these.
Oh yeah, no, go for it.
Okay. What advice would you give to a current M1 or M2 who is wanting to match EM? What are some things that should be on our radar to help prepare us for match and subsequently success in residency? Anything that sets us apart?
The interns want to take that one?
Yeah, you guys still there?
Yes, we're still here. Sorry about that. I think that's a great question. I think you guys could weigh in on that as well. For everyone who's interested in EM, I think my best advice, and everyone probably thinks about this differently, is like to keep your options open, to really work hard and make sure that you're enjoying all of your rotations and getting what you want out of them, and thinking about whether you could see yourself in that role every day for the rest of your life and if it would fill your cup up. And I think I really try to stay open-minded. And then in terms of like the things you can do to build yourself up, everyone is a different and unique applicant, but just doing the research and extracurriculars, finding things that you're engaged about, whatever those are, and working hard to bring something unique to your application, I think will be an asset, whatever you end up applying to, and will set you up well, especially if you change your mind at the last minute. I know when we are so lucky at our program to get to be really involved in admissions as residents, and when I'm reading applications, it's so apparent to me who's really passionate about the different projects they've worked on, whether it's research or a free clinic or many of those things. So I think find the things you're passionate about and like really showcase those and work hard at them and enjoy your rotations and make sure it's what you actually want to be doing. I don't know. Do you guys have anything to add to that?
Not really. Try hard, do good. It shows up. Yeah.
Great.
Awesome. You couldn't have said it better. That was perfect, Maddie.
Okay. Are you open to accepting DO students? And if so, is it mandatory for them to take USMLE Step 1, or can COMLEX Level 1 be substituted?
Well, harsh.
Oh, yeah.
I'll be quiet.
No, we haven't talked, Rob. You haven't gotten to talk yet.
After we took us, they don't want to take DOs anymore.
Yeah, I think my own personal soapbox is that it's BS that you have to take 2 exams. They're so expensive. You have to study for 2. So we are fine accepting the COMLEX exams and not both, because I think that's an extra cost burden. You guys shouldn't have to float that. So we are very DO friendly. Please apply. And I don't care if you take Step 1.
Okay. I'll leave, the chat's going to be open, so I'll monitor that, but just so there's no awkward silence. I have some rapid fire questions for you guys. So I have a question about being a chief. What's a day in the life of a chief look like?
As a fresh chief for 2 weeks, I'll tell you, it's a lot of fun in terms of you get to come to events like these. You get to do a lot of higher level organization. You get to work through scheduling. I will say there's definitely times you have to set boundaries. I have some of my best friends in the family medicine residency asking me for certain days off on their schedule. And I have to tell them there's a friend side of things and a professional side of things. And if they request off, I'll treat them like everybody else that requests off, and we'll work through it together. But it is fun because I feel like our leadership is super open, receptive to change. There's not many things that we want changed because everything's already super good here. But anytime we bring up anything that we're like, oh, it'd be cool to have this lecture at conference, or it'd be cool to have this extra rotation, and everybody jumps right on board. So I feel we make an impact as chiefs and honestly residency class, because everybody's just super receptive and our voices are well heard and echoed throughout.
All right, next question is for you, Dr. Bollier. So you were APD and then you became program director. My question is, what did your vision change for the program when you became director? If so, what different things have you implemented? Yeah, just your journey to becoming program director.
Yeah, I think our team is still the same team. Our former program director was amazing. Dr. Susan Stroud, who was first program director, or was that? Yeah. And then second from after Steve Hartzell, and was just PD for a very long time, trained some really amazing residents. So I was lucky enough to inherit just an amazing program, and our whole team is the same. Rob has been an associate PD for a long time. We have Christine Rapps, Brendan Cummins, and TJ got added to our group as well. But we've been pretty consistent with our team. So I'm just really happy and lucky that I work on such a great group. And then in terms of changes, I think there were some things that I wanted to change, and we based it off of resident feedback. So there was a rotation that the residents had been doing for a long time when we were under the Department of Surgery. And it was basically a general surgery rotation for intern year. And the current interns are finishing that out. But what we did was we thought about what the benefits were, and there's benefits to every single rotation you do, no matter what it is. But the kind of cons were outweighing the pros at this point. So we took that away, and that was how we're able to add in IR and peds anesthesia, which Rob set up after a long time kind of negotiating with them. We're very open to feedback. We want resident feedback, and we're definitely open to making changes within the program.
Great. We have a question in the chat. Being not from Utah, childcare during residency seems really challenging. How have residents handled childcare with two working parents?
Yeah, childcare and having kids in residency is definitely hard, but we are very supportive of our families. We have multiple residents right now that have kids, and I think 4 of our incoming interns all have a couple kids, or more, one has 7. And so we are we're very supportive of families. We have a whole list of childcare resources, the daycares that are like vetted by attendings and residents, and different opportunities in that sense. Your whole family is welcome to retreat. Your whole family can come to all the events, like our annual holiday party. We have a gift swap for the kids and for the adults. We have very supportive environment, but there's lots of daycare options, and that's probably what I would recommend. Some people get nannies if you can, but I think there's good hours with the daycare.
Dr. Bollier, where do you want the program to go under your leadership? And I guess Dr. Steven, you can chime in on this too. Like, where do you see the program going?
Yeah, Rob, do you want to take one?
We just want to make sure you're awake.
I'm awake. Harsh is keeping me awake.
You don't want to hear our thoughts on the answer to this answer to this question.
I know what they'll be. A lot of this is going to clearly depend on how this goes with transitioning to a 4th-year program. I think the issue here is it's most likely going to happen, and then it's a matter of what we can do within that 4-year structure. We've already, I think, not to toot our own horn, but we've already implemented some of the new requirements. For example, rotations in critical access hospitals and under-resourced hospitals. We've already got that going. We have the one out at Mountain West that Harsh was talking about that's in between here and Nowhere, Nevada. And then we've also got one down on the Navajo Indian Reservation in Shiprock. So some of those things we're already ahead of. We're starting some other things. I would like to see some other experiences. So for example, we're going to try to get up an ophthalmology and an ENT experience to get you some of those more unusual things, get you familiar with some of these more specialty cares, particularly if you're going to be in the critical access place, and things that really freak everyone out, like trachs, which I don't care what you say, they freak everyone out when a bad trach comes in. I see us, we've incorporated some things that are going to require, and then moving to make sure that we can keep refining and adding experiences where we feel it needs, or the need comes up and the need becomes available. For example, the pediatric anesthesia rotation, that has been forever in the making. We have been trying to get a rotation like that, I kid you not, for about 15 years. And so to finally get it done was like a big accomplishment, most of which goes to Susan Stroud. But those kinds of things, as we keep working on stuff and we keep trying to give people experiences that we think will be clinically applicable, if that makes sense.
Yeah, that's awesome. And I feel like it seems like we have the foresight for the ACGME changes as well. So Rob has also developed both ENT and ophtho electives, which we'll just build into our program with the 4-year rotation, and same with acute pain service with all the nerve blocks that are now being required. So we're already working on developing all of those rotations. So we're pretty ahead of the game. I don't think we're worried about the ACGME changes. I think it gives us another year to craft some full curricula, but we actually already have most of it already built into our program.
Okay, great. I would like to know more about the sporting events. I guess how often do residents get to participate in sporting events? Do you have to be like part of an EMS track within the residency to be able to staff some of those, or like what events do you get to go to?
The answer is you can do anything at any time, and you don't have to be a part of anything. So I like palliative care. I like sports medicine. I don't know how to combine those two, so I don't think I'm going to do either fellowship, but I like to hang out with both the groups. And so I did the marathon staffing last year. I did Salt Lake like road bike race last year, which was super fun. I was the only doctor, and there was a bunch of EMTs. And ultimately there was this like 15 cyclist crash, and it's basically a mini mass casualty event where we're just pulling people off. I'm triaging them. The EMS folks are doing like bandaging them, and then I get to sit down and do sutures. We have the hockey games now, which you can go work like the crowd portion of it. So you can work with EMS, you can work with one of our faculty members. And if somebody falls down the stairs after being inebriated from the 3rd level from Harsh's season ticket seats, then you get to go take care of Harsh at the hockey game, but you can't necessarily be quite with the team yet. We used to do some really cool experiences with the Jazz. I think that's still there, but nobody has done it in the last, I think, year, because there's just so much to do out here.
You can do effectively the same thing between the hockey games and the Jazz games. The Jazz games, technically, if you do, I think we're actually also in charge of if a player goes into cardiac arrest, whereas the hockey games, like the NHL requires a specific ER attending physician to be responsible for the hockey players having some sort of crazy emergency. So as a resident, you wouldn't necessarily be involved on that side of it, at least not yet. But for the Jazz games, yeah, you're basically helping out with anything in that whole arena. Obviously, the occasions of a basketball player going into cardiac arrest are pretty low, but if it were to happen, you would help care for them.
We also have, there's UFC fights that came to town that you have the opportunity to staff. There's always concerts, lots and lots of concerts that you have the opportunity to staff. And so basically, I found it super easy. You just email people, and honestly, it's Nate Roll on our team, and he's incredible. And he's been with us for, I think, 20 years since he was an EMT, is like 17. But yeah, it's easy to get involved, and you don't have to be on a track or do anything. You can just pick up whatever you want.
Awesome. Intern crew, you guys got anything that you guys did that you wanted to add?
I don't know that any of the three of us have made it to any events yet, but Jess is doing the Salt Lake Marathon in 2 weeks. So we'll have more to report back on. And I think now that we're settled in a little bit more with some of these spring events, we're excited to get our feet a little bit wet and dive in.
Awesome. I see the next question about AI and charting. We have Keaton at our program, and he is just an absolute powerhouse. He does all of our informatics. He is on top of all the software, making sure our billing is up to date. He gives all the resident lectures, and he's just like an all-around amazing, like all-star attending, an informatics genius. And he's working right now on piloting some of the AI programs with the residents. And right now we're just having PGY3s that work directly with Keaton can use the software. And maybe that will expand in the future to all PGY3s. But right now we're just trialing it, and we don't really know where it's going to go. So we need a little bit more data and information, but we do have an attending that's actively gathering that for us.
And the U is like specifically working to build it out, integrated into Epic. So at some point it'll be a thing.
And we're one of the pilot sites.
Yeah.
Okay, interns, if you're still with us, how was the transition from fourth year graduating to intern year?
Sorry for the delay there. Yes, I would say that it was a great transition. We heard a little bit about Educational Month earlier on in the call, and I think that's something unique about our program that was really special. We had a whole month to get both settled into shifts, both at IMC and the U, which are our primary sites, and also a lot of time together learning procedures and going through some educational modules, which I felt like, at least for me, and I don't know how you guys feel, like helped us hit the ground running when we had opportunities to do procedures on other rotations. Early on, I felt really competent and prepared to do that. It was also a great time to bond with your friends because you're on a pretty similar schedule with them, which is not the case for the rest of the year, and it's a little bit harder to get everyone into the same room. So
Yeah, I would echo that. I think especially because so many of us, and I think oftentimes our classes come from all across the US. So we don't know Salt Lake, we don't know where to get our groceries, and we don't know each other. Like to have 6 weeks where you're on the same schedule and you can make really strong bonds, it makes the rest of the year very manageable. Yeah, I second all of that too. I think honestly, the transition from fourth year to residency is going to be tough no matter what. You're in a different role and it's in a different environment. And everyone is going to handle that transition slightly differently, but it's a good thing. Yeah, it's a good thing. And you enjoy it and you feel like you're more responsible for things and your decisions are frankly just like a little more valued and you get to make a lot more decisions that actually impact patient care. And here I felt supported from day one to make those decisions.
Okay. Thank you. I saw we had a four-legged friend join us.
yes, this is Ellie. She is wandering around on the porch trying to eat our leftover pizza right now. So delightful.
Great. All right, we're heading towards the end here. So if all of you want to give some last-minute words of wisdom, can be related to anything, a fun case you just saw, anything you'd like to share, but you can't repeat anything that somebody said.
Ooh, last words of wisdom.
I just got to give 3 interns 3 intubations on one shift on Friday, so that was fun.
My last 5 shifts, I've had 6 STEMIs and 3 cardiac arrests, and one of them was at Riverton where I got to intubate, chest tube, pace, art line, central line, and then ship, which was pretty cool.
I hate you.
So there's a lot of fun to be had here and a lot of really cool learning.
I think, like we said earlier, enjoy the process. We would be thrilled to have you at Utah, but I think there's so much good learning between now and wherever you match. and it's really fun. So enjoy all the things along the way too.
Okay, super wise here. Words of wisdom. I would say enjoy the last parts of fourth year. You like take advantage of it, have fun, see your family, see your friends, spend time with your dogs, like whatever fills your cup up. Really take time to fill your cup up. And then I strongly believe in find a place that fits you. Don't make yourself fit into a place. So find who you are and own that and be comfortable and confident in who you are. And you're going to do great. There you go.
Oh my gosh. Okay. I guess I would say as full of an opportunity as medical school is and as much as you can learn, I would prefer to be a resident every single day of residency over a medical student. So it just continues to get Rob with advice. I want to hear Rob's advice.
No one wants to hear my advice. Kirsch tells me that every day. No, I don't. My main thing, I guess, would be just make sure you enjoy what you do. All right. This is a hard job. And if you do it just because you think the lifestyle is the way you're going to go, you're not going to enjoy yourself. The old adage about it's better to do something you love for 80 hours a week than something you hate, or the other way around, something you like for 80 hours a week than something you hate for 40. So just make sure you really enjoy it. It's a great profession. It's a great field. It has its ups and its downs. Just go into it with wide open eyes and make sure you really enjoy it. Because if you do, you'll do fine no matter where you go.
Awesome. You guys had really excellent advice. I would just say that we really love this program. We all care about each other. And I think that's what makes our program really special. Hopefully you were able to see that tonight. But thank you so much for coming and attending our session and our showcase. And thank you, Dr. Steven and our residents for taking some time out of their parties to come hang out with you guys. So I appreciate you all.
This is great. Students never get to see residents like at a party A or B, just like having fun with each other. So we always just see pictures like on slides, but we get to see it live in the flesh this time. So it's great.
Maddie, Jess, and Paige, and Allie B, and Rob, you guys are all still welcome to come over to Passover at Frankie's house.
All right. Thank you all so
Thanks.
much. Again, students, we have our next showcase again this week on Thursday. I forget what day it is, Tuesday. So hope you guys can tune in for that. Thank you again, everyone at the U, for taking time out of your schedules. It means a lot that you can spend time with us when you're supposed to be partying. Take time out of your busy schedules to share more about the amazing program at the U. So with that, we're at the end of our time. I appreciate it. And I hope you guys have fun at your party. And then third years start applying to the application and open today. So thank you all.
Thank you.
All right. Bye, everyone.